Good day everyone, I'm Angeline and I'm going to discuss the venous thrombosis and the deep vein thrombosis. So, um, in the slow moving of the blood of the venous system, there will be a changes in the blood composition, and there is a reduction of the blood flow or changes in the vessel wall that can result in a formation of fibrin-rich clots. So these clots form through the activation of the coagulation cascade, um, that culminating in the factor 10A, which is mediated to the generation of thrombin, and the thrombin is mediated to the cleavage of the soluble fibrinogen to the insoluble fibrin, and this fibrin is form a long strand. As you can see in our pictures, there's a long strand, um, which it can cross-link and form a mesh. As you can see, there is a mesh um, that will trap the passing red blood cells and platelets. So over time, it will be build up to form a clot. As you can see, that is the sample of blood clot. So if the kind of blood clot form in the large veins of the legs and our lower extremities, tinatawag na tong deep vein thrombosis or the DVT. So yung DVT is magiging fatal siya kung nag-break yung blood clot na yon at mag-travel through the lungs. Bakit? Kasi yung role ng venous system natin is dinideliver niya yung mga unoxygenated blood papunta sa heart. So, pag yung blood clot natin sa legs is ma-break or ma-dislodge, tapos mag-travel siya papunta pataas sa inferior vena cava, mag-travel sa heart. Tapos pag mayroong ma-block na arteries sa lungs, ito na yung complication na tinatawag na pulmonary embolism. So yung venous thrombosis is binubuo ng maraming red blood cells, may platelets, may WBC, and yung fibrin na long strand na nakikita nyo. So, yung pag sinabi natin venous thrombosis, maaari siyang mabuo sa kahit saan sa ating venous system. Pero usually common siya sa lower extremities. So, kaya may tinatawag tayong na deep vein thrombosis kasi usually, yung clot is na-form sa large vein sa legs natin. So, nakikita naman yun yung structure. So, yun yung structure ng blood clot sa veins natin. So, ano nga ba yung most susceptible na veins for DVTs? So, ito yung peroneal, posterior tibial, the popliteal, and the superficial femoral. In the United States, more than 200,000 people ang nagkakaroon ng venous thrombosis. Tapos, 50,000 people doon ang nagkakaroon ng complications ng pulmonary embolism. So, here we come for the pathophysiology. So, the central theory behind the etiology of DVT can be summarized to Virchow's triad. So, in the DVT are causes by some combination of venous stasis, endothelial injury, and hypercoagulability. So, start tayo sa venous stasis. So, what are the conditions that causes venous stasis? So, first is the patient has a varicose veins. And the patient is immobilized. This patient might be bedridden after an injury or after a trauma or surgery. A long travel, like having a long ride for more than 5 hours with the car or plane. And also obesity can cause venous stasis because it increases the estrogen and progesterone fat tissue. And hypercoagulability, we have cancer because it can make change in the metabolism of our body. And we have also the severe illness like sepsis because of endotoxins reason to how our blood able to clot. And we also have dehydration, usage of estrogen, the birth control, and the postpartum period. So, and the endothelial damage, it can be indirectly or directly damage the lining of the blood vessels that can lead to blood clot. We have the indwelling catheter like Angeline or heart valve. You have also the medication that can hard on the veins that can damage of the lining inside the vein. And you have the any type of trauma or injury to the vessels like surgery and some of major trauma. So in the coagulation cascades, we have the intrinsic pathway, extrinsic pathway, and the common pathway. When in intrinsic pathway, it starts with the surface contact with collagen, kallikrein, and HMWK. In extrinsic pathway naman is leads to direct damage to the endothelial tissue and exposure of the tissue factor and its kinds of ends together. While the common pathway is you will end up with fibrin clot. So, dito muna tayo sa endothelial injury. So, if you're damaging the endothelium or if somebody manipulate a vein or a broken vein, and you're going to expose to the collagen and start down to the intrinsic pathway, or you will have the damage to endothelial tissue, and have a tissue factor that leads to extrinsic pathway. So, in venous stasis naman is we have the accumulation of procoagulant factors that can lead to the blood clotting causing DVT. We have also the hypercoagulable state that can be either have an accumulation of procoagulant factors or you have a shortage of anticoagulants factor, but in case you have imbalance that lead to a clot and that can enter kind of intrinsic pathway or through a common pathway. So at the end in a common pathway, you will have the stable fibrin clot, which leads to degeneration of a thrombus, and it's typically in the lower extremities, proximal deep veins, and it happens at the knee or above, and it will be in a deep vein. So this means that they are not close to the skin, veins that are deeper towards the center of the leg, away from the skin, and where the DVTs tend to form. So now we will talk about how the anticoagulant medicine help to treat the DVTs. So first, we have the warfarin. Warfarin is a very common oral anticoagulant and that enters the pathway by blocking the epoxide reductase of vitamin K. So this is going to decrease the factor 2, 7, 9, and 10, as well decrease the protein synthesis. So the warfarin will have a direct blocking effects on the intrinsic and extrinsic pathway. So second, we see here the thrombin in the intrinsic pathway and the common pathway. So the heparin is a blocking the effect of thrombin
in different ways. We also have the anticoagulants that directly block the factor 10A, which is the apexaban and the rivaroxaban. So you will notice that the factor 10A is in the intrinsic pathway. So when you're blocking factor 10A, you're blocking the intrinsic pathway. And lastly, if the case is acute, you might use the atiplase, or it's also called the TPA. The TPA stands for tissue plasminogen activation. This causes the reactions of the body. Plasminogen gets converted into plasmin, and plasmin directly breaks down a clot, and in some cases it causes heavy bleeding if you're breaking down the fibrin clot. So now we will go to the clinical manifestation of the DVT. The symptoms usually happen unilaterally because it's unlikely to have a DVT in both legs occurring in the same times. Well, the common symptoms is leg swelling. You might also have leg tightness, leg heaviness, and patient can have a fever as well, especially if there is an inflammatory etiology to the DVT. The patient can have also a pain in their legs, usually described as a dull pain, and it's get worse when you start walking or using that leg. If it's elevated, it might make it a little better. And last, we have also the pathognomonic sign of DVT, which is called Homan signs. It is when you have a cuffing on the dorsal flexion of the foot. So, yung complication ng DVT, if it travel to the lungs, kagaya ng sinasabi ko kanina, na pag yung blood clot sa DVT is ma-dislodge, tapos mag-travel to the lungs, tapos mag-block ng one of the arteries of the lungs, it can cause a pulmonary embolism. At yung patient ay makakaramdam ng dyspnea, chest pain, dizziness, and weakness. And the other complication of DVT is stroke, because if your heart does not close and end up throwing a DVT up towards your heart, it would lead to stroke. The DVT start in your veins, unable to pass from the right side of the heart to the left side of the heart, and end up in the systemic circulation. If it goes up to your brain, you end up of stroke and have the stroke symptoms, such as numb or weak extremities, confusion, speak or hair vision deficit. The last complication of DVT is if it mixes with bacteria. So DVT plus bacteria is equals to superlative thrombophlebitis. It's an infectious process with a predisposing risk factor of indwelling catheter like IV drug. So the surgical management for DVT is we have the thrombectomy, which is it is remove the blood clot from the inside of the artery or the vein. We also have the vena cava filter. It is placed in the inferior vena cava. It's a small metal device. As you can see, it is placed in the inferior vena cava to prevent the blood clots from entering the heart and lungs. It is sometimes placed in the patients who can take the anticoagulants. So now we will discuss the nursing intervention for DVT. So you will just remember the acronym of deep clot for the nursing intervention of DVT. So First, we have don't massage or rub the affected area because it can dislodge the clot and lead to pulmonary embolism. Second, we have the elevate the affected extremity above the heart level. This is going to help to promote the blood return and decrease the swelling. Next, we have the ensure bed rest because we don't want the clot to dislodge. That's why we promote the ensure the bed rest. So, next is pharmacological measures. We should measure the effect of this anticoagulant drugs, and we should reminded that anticoagulants do not break the existing clot, but it helps to prevent the clot from getting bigger and new clots from forming. So, if heparins has a toxicity, we have the antidote of protamine sulfate. If warfarin has a toxicity, we have the antidote of vitamin K. Next is C. Compresses warm and moist to affected area. It is help the pain that patient have and help the circulation. Next is leg conference. It will compare the measurement of the ineffective leg because having a DVT is a unilateral. Next is for observed signs and symptoms of pulmonary embolism. You will observe if the patient have a shortness of breath, coughing, decrease of oxygen saturation, fast heart rate, chest pain, or she have anxiety or sweating. And last is tight compressions stacking. It would be thigh or knee high. It is promote the blood flow and decrease the swelling. The fit of the stocking is depends of the doctor's order. The prognosis of DVT. So, nare-resolve yung DVT without complication. But the risk of recurrence of DVT is high up to 25%. And 6% of DVT cases died and 12% has pulmonary embolism.